2, 1. Hello, everyone. My name is Dr. Larry Mitnaul. For those who haven't already been following the channel, whether it be TikTok or Instagram or YouTube, and I'm excited to be on here and to give this a try. So this is a forum for us to just kind of connect for the next, 15, 20 minutes or so, to talk about, what's on your mind. If there are questions that you have about psychiatry, and especially child and adolescent psychiatry. So for those who don't know, so that's what I do. I practice child and adolescent psychiatry. I see kiddos from 5 years old to 18 plus. Usually 18 is when people graduate me, but as you may know, the world has been really different, and the way that our kids have been struggling through COVID has kind of delayed some of their launch dates, and so there have been kiddos who stay with me a little bit longer. So maybe you have some questions. Maybe you have questions about diagnosis, or questions about medication, or question about what do psychiatrists actually do, or what tests do we order, or maybe you have questions just about parenting and that sort of thing. So again, those who are familiar with the channel probably know, because you've seen some of my videos, I really have such a strong emphasis on parenting and helping parents to feel more confident and strong, and certainly that's a core part of who I am. So if you're new to joining us here, feel free to ask me your questions. What's on your mind? There are some limits, right? So obviously, if you are one of my patients, I'm not going to be able to answer any particular medication or therapy questions, and so there might be some particulars too about medication or about recommendations that I might not be able to give you personally. But let's jump in. So it looks like I already have a question here. How do you know when a behavior is something to worry about, like biting or hitting? Okay, so the first is age, right? So biting or hitting at 18 is definitely a no-go, and a reason for significant concern. Biting and hitting can be one of the things that we see in prototypical, neurotypical kids. So we don't necessarily assign a diagnosis for seeing that at a young age. However, it is a behavior that needs to be curbed, because we want our kids presenting well. We want them to be able to establish meaningful friendships. We want them to do well in the spaces that they occupy. So that's school, that's church, that's daycare, all of those things. So anytime you see that behavior, it is something worth correcting. Typically, if they're preschool age, that isn't anything that we necessarily need to, put them in front of a therapist, or be thinking about medication as a treatment strategy. But it is a behavior to shape. And so some of you might not know this, but if you check out the link in my description for Be Well Academy, those crucial years of connection are really the foundation and springboard for helping our kids to do the best that they can do. And so I kind of created a course with that in mind, with helping the parent who's thinking about, all right, I really want a strong connection with my child, and I want their behaviors to be, something that allows them to be successful in the world. So, all right, there's another question here. Do you believe in complete freedom? Like, if you aren't restrictive, let them learn what's good and bad. All right, so that's a really deep question, and I could probably go to a level that might be a little bit too much. But here's the overarching thing. One, humans learn by instruction, right? And the older that you get, the more efficient you are at using someone else's pain point, learning from someone else's story, and putting that in place in your day-to-day life. But with kids don't yet have that, right? So we are often supplying the stories, and we're also helping shape behavior that might not be getting them in immediate trouble, but that's a habit that's gonna be harmful for them in the future. So in terms of complete freedom, I don't, I don't believe in complete freedom if what that means is, I let my kids choose whatever they want and to totally self-determine their life and lifestyle. Why? Because they will pick Lucky Charms for breakfast, lunch, and dinner. They will also pick, no chores and no participation within the family. They'll choose video games over being outside, learning a hobby, picking up a healthy habit or learning a language. And so really it's a dynamic, it's a dance is the short answer. That we want to allow kids to have freedom, but not a freedom that imperils their lives or isn't something that they're able to learn from, right? So the only reason that we don't allow our children and babies to drive a car is because they can't be safe behind the wheel, not because we don't want them to go places. So that's kind of the balance and maybe way to think about that. Again, guys, please feel free to drop in and give me your questions. You guys are firing really strong, so I appreciate what you've been sending my way. You're welcome, Marcy. Thank you. Let's see. Oh, someone found me from the sleepover videos, which has been causing some controversy, I think. How do you tell kids no? I mean, the simplest way, the most straightforward is just to say it, but to say it in love. And here's the thing that comes before the no, right? Before the no, there is a dance that kids and parents are already engaged in when they mean to connect, right? And so I think a family or a parent who begins with looking for opportunities to say yes to your child, meaning I want to say yes when you're taking on really strong challenges. I want to say yes in things that maybe have a little bit of a risk that allow you to learn and to accomplish and to thrive, but there are going to be certain things that I limit the yes that I give to you. So in terms of saying no to kids, a child who is in a really great, firmly attached connection with their parent, they can hear no because they also hear the yes. They hear the yes when you say, I know we don't have ice cream for breakfast, but you've been doing such a great job. It's ice cream time and it's breakfast. Okay, so that no, you can deliver it with love. And be bold and be strong and courageous, parents, because you know what's best for your child. All right, someone asks, Egont, if I'm pronouncing that well, again, thanks for your great question. What are atypical symptoms of ADHD in preschool-aged girls? We have a family history, and I feel half, or 1/2. So I'm not sure fully what the second half of that was. Oh, half there? Halfway there, maybe? Is that might be what she means? Let me start answering the question, and then you fill in if you need me to clarify. So when you say atypical symptoms of ADHD in preschool girls, I probably should clarify for those first watching. So ADHD is a frontal lobe, issue, meaning that part of the brain that's responsible for helping adults to push pause or to break in terms of their activities, actions, and choices. That's part of what the frontal lobe is responsible for. Kids with ADHD have a deficit, have a difficulty being able to apply that break appropriately. Now, what's trickier when looking at younger and younger age kids is that we know that their young brains are underdeveloped compared to their older peers, right? So a 5-year-old brain and a 25-year-old brain, the 5-year-old brain is just going to look immature if we put both of those things in an fMRI machine looking at kind of how their brain is developing. So what are the core symptoms? The core symptoms are inattentiveness, distractibility, hyperactivity, and impulsivity, right? So those are maybe 4 of the domains that we might look at. So when you say atypical symptoms of ADHD, I might need to know more about what are the things that fit outside of that category that you're seeing in a preschool-aged girl. We do know that there are differences. There are just differences between boys and girls and how ADHD looks. Girls tend to be a little less on the impulsive side, meaning that they're less likely to be the ones running around the classroom and doing backflips off the desk. That's just the way it typically looks. But it can present in that way as well, and those are reasons to make sure those things are being addressed. You also mentioned in your question about having a family history, and we do know that it's a neurodevelopmental disorder, and so It does fall in families. All right, so good. She clarified, or Egon clarified, big emotions, very sensitive, creative, and intuitive. Okay, so there are a couple of ways to read that. That might not actually be ADHD. That might be more of personality and temperament style, right? And so we know that some of our kids are just wired for a little bit more sensitivity to their environment, or a little bit more sensitivity when it comes to handling things that they don't expect, right? Some of that, so you can see how some kids that might look like, anxiety and worry, because they're not sure what to expect about the future, that they worry and perseverate a little bit, and when things don't go as their mind predicts it should be, then really big emotions come out, or they can look really sensitive. So that's a really great question. It's one of those things that it's hard to know about an individual child without asking more clarifying questions about how they work through the day, and what are some of the things that you guys have found out work or don't work for your child. So great questions, you guys. All right. Oh, so I have about 5 more minutes in terms of our time together. I feel like you guys are getting some value from this, so let me know in the comments, and certainly if there are any themes or things in the future that we should be working on. For those who are also new, I mentioned a little bit earlier, so I actually do have courses and webinars too that are related to psychiatry, psychology, and just parenting in the age of screens in general. And so you'll definitely want to check that out in the link in my profile if you haven't already. As a matter of fact, there's a masterclass that I have coming up. There's very little room in that. I think there are just about 10 seats, where we're talking about helping kids overcome kind of their addiction to screens, and things that parents can do, and strategies that they can employ to help their kids get free so that they're living their best life. All right. Good. Someone asked, at what age can a child be diagnosed with, I think ND, she's meaning neurodevelopmental disorder, and then she gives the example of ADHD, which is a neurodevelopmental disorder. Most of our, so if we use the DSM-5, which goes through iterations of being, clarified, every, 5 to 10 years. It really isn't set up to a calendar necessarily. But most of these diagnoses are really targeted towards kids by age 6, that we're able to kind of clarify where it is that they stand. Now, here's the thing about diagnosis, guys. So while diagnosis is important, obviously, in clarifying what are the great strategies that we can use. And by strategies, I mean not just medication, although that's often what people think of first. It's also therapy, it's nutrition, it's environment, it's school setting, it's evaluating maybe for learning differences as well. And so just because our diagnostic paradigm is to evaluate kids and typically treat or give them the firm diagnosis by age 5 or 6, that doesn't mean that they weren't struggling with ADHD or autism spectrum disorder kind of prior to that diagnosis. And so you might ask, then, is there really a limit? Can you meet a 3-year-old who meets early signs of, say, autism spectrum or ADHD? And the answer is yes. The difference might be what we decide to do about it, and how to best proceed, and how to help kids of that age be as successful as they can be. Let's see. Oh, so someone writes that about that that they themselves have ADHD, and twin sons are 3 years old, and so you may be seeing that. I can't, obviously I can't diagnose them, but there may be some signs and symptoms early on that maybe they may meet criteria for the diagnosis. But I often caution parents, though, from diagnosing their children. I think you take the behaviors and the things that you see, and then look for strategies that work kind of best for that child. prematurely sometimes, casting all behavior as necessarily a behavioral disorder or a psychiatric disorder can sometimes work against us, in that we in the way that we decide to proceed or not proceed, or to give them opportunities or not give them opportunities. So is there a chance? For sure. Is there a higher chance than the general population that your children might grow up and develop ADHD, or might have symptoms and signs of ADHD? The answer is yes. The most important thing is to love them, and knowing what your experience has been, kind of bringing that to bear. And so let me give you an example, right? So I'm talking in generalities, but here's a specific example. So if I know that I have a child who is maybe a little bit more distractible than most neurotypical kids, then I'm less likely to give them multi-step instructions where that gives them a chance to be really, really frustrated, right? I'm not going to say pick up your socks, put away the bowl, and brush your teeth, because they're very rarely going to make it to step 2 and step 3, and both my frustration level and their frustration level are not going to be good for us building a relationship and a bond together. So if I recognize those habits in my kids, then I'm going to change the way that I pitch my instructions so that our life together is filled with more peace. So hopefully that's helpful for you too. All right, there are a couple more questions coming in. Unfortunately, I'm not probably going to be able to get to all of them, guys, but we're going to do more of this, seeing how great you guys are at interacting. Let's see. Someone says they're looking for a diagnosis. Good. So I'm just scanning through the questions, seeing if I can maybe answer a couple of them in brief kind of summary, to leave you with a little bit of something. So let's see. As she gets older, saying things to myself, trying to discern ADHD or age appropriate. Good. So I think that is really important, and the most important kind of watchful, loving gaze is you, the parent, kind of recognizing, here are things that I see in my child. And again, knowing and seeing a pattern doesn't necessarily mean that they qualify as having a psychiatric diagnosis, but recognizing that and looking for workable strategies will be helpful. And we can talk about that more. So if you have enjoyed our conversation and are maybe wanting to take a deeper dive, or have other particular conversations or questions for me, I'd love to continue to do this with you guys. And again, don't forget to follow. If you don't want to miss anything, if you want to be like the most connected to the places where we are, make sure that you're checking out my channel. So certainly the Be Well Academy in the link has the email newsletter, so that way I have some articles that have come out recently. There's one in Yahoo News and Business Insider, but not missing any of that content or information, and also the webinars and classes too. You're not going to want to miss any of that. So I'm checking my team too to be sure I'm not missing anything important for you guys to know. Let's see. Let's see. At what age do you think a child can make a decision for themselves? That is such a good question. And the truth is, at any age. The bigger point of that is when can what is the range of the decision? Like, what is the risk and consequence of the decision that your child might be making? So I love giving children kind of multiple ways to answer a question that allow them to make a choice, right? So the 1.5-year-old, the choice might be between the red and blue shoes. It might be between this dish or that dish if I've made kind of multiple things. But there might be certain decisions actually that they're not capable of making, or not making in a way that serves their best interest. So can I go to school versus not going to school? That answer I can guarantee is going to be, we're going to school today, son. But I love that question, because it points to looking for opportunities to help our kids to grow and to be independent and to make really good choices. So I hope that's been helpful, my friends. Take good care. Be well. I'm Dr. Mitnaul with Be Well Academy. And this has been fun being live with you. So let's do this again. All right. Take care.